Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. This is of a patient who attended with very itchy and irritable ears. That was their main complaint. So they did have some earwax in the ears and a lot of dead skin coating the ear canal. So you can see there, this is the patient's right ear. By the way, the left ear is the worst one of the two, so do stay tuned. After the right, you will see the left. And we could see the top part of the eardrum, even with the occlusion. So this debris wasn't necessarily affecting the hearing, although on the left side they felt it was because there's more of a significant blockage. But their main complaint, as I mentioned at the beginning, was this itchiness and irritation in the ears. And you can see the patient's got a very thin, almost invisible layer of dead skin. And it's coating the entire ear canal, almost like a snake skin. And what we're doing now, I'm just gently peeling away this dead skin keratin using a fine end suction probe. And you're going to be really, really delicate and gentle. We don't want to be touching the canal wall. At the same time, skin can be really adhesive. It can be like a really, almost like sticky tape. And it sticks to the canal wall and it's really, really strongly adhered. And we have to, with a bit of gentle force, should I say, just peel it away. But as we're doing that, we just got to make sure that suction probe is not going to be making contact with the canal wall. So already the ear's looking a lot better, but there's still a bit of skin laterally now. So this is near the entrance. And so in this patient has got a condition called otitis externa. It's like a psoriasis eczema of the ear. The skin is dying. But it's not shedding naturally and migrating out of the ear. So let's explain the ear anatomy. Now, if you've been watching my videos for a while, you probably know this already, but obviously we always get new subscribers all the time. So I'd just like to educate. The videos are designed to educate everyone, even the new subscribers. The ear canal is lined with a layer of skin. Now, the skin on the outer third, the cartilaginous portion, so the ear, think about the ear in thirds. So the outer third is made up of cartilage and the inner two thirds is made up of bone. So the outer third, the cartilaginous portion, that's semi-flexible and semi-sensitive. And the skin that lines the cartilaginous portion is a lot thicker. It's a millimetre in thickness. As we enter the bony part of the ear canal, so the inner two thirds, the skin is a lot thinner. It's almost 15 times thinner, so less than 0.1 millimetres in thickness. And this skin is directly adhered to the bony part of the ear canal wall. There's no kind of dermis layer of skin, there's no cartilage there or fatty tissue buffering it. It's literally skin on bone. And also the eardrum, so the eardrum has three membranes. The outermost membrane that's facing towards us, we call that the lateral membrane. That's made up of the same skin that lines the inner two thirds of the ear canal. The innermost membrane is a mucosa layer of skin. So that's the similar skin to which lines are inside of our mouth and the nose. And then the middle layer is a connective tissue and fibrous layer. That's what gives the eardrum its strength and rigidity. Now, the ear has evolved over millennia in that, so as the skin dies and sheds, it naturally migrates out of the ear, almost like a conveyor belt. And as it does, not only does it clear the ear of the dead skin, otherwise everyone's ears would be blocked full of dead skin continuously, but any wax sitting on the surface of the skin is also naturally transported out of the ear. And it's a continuous process, and this skin migrates at a rate between 1.5 millimetres and 3 millimetres a month. So it's similar to our fingernail growth. So if I was to get a black marker, a permanent marker, make a dot on the middle of the eardrum, and we monitor that patient over the next 10 months, for example, over periodically every month for the next 10 months, we'll see that black dot slowly but surely migrating out of the ear. And the analogy I use is the ripple effect. So imagine you have a pond and you get a pebble and you drop the pebble in the middle of the pond, you'll see these ripples. And imagine those ripples from the centre of the pond being the skin from the centre of the eardrum, and it migrates outwards slowly but surely. But in this patient, the skin isn't migrating. It's just because of the eczema psoriasis, they're getting excessive dead skin in the ear, and that skin is just coating the canal. It's not migrating and it becomes very itchy for the patient. So the right ear's done. You can see a very healthy eardrum. Now, the left side, they did experience a bit of hearing loss upon attending and also fullness because the blockage was more significant. We couldn't see the eardrum. So that blockage I removed relatively quickly. So Instantly, the patient's hearing's a lot better, the feeling of being full is improved, but obviously they've still got this itchiness and irritation. And what we're trying to do now, as gently as possible, is just to peel away this dead skin. And this skin is coating the entire ear canal, so it is tricky. Now, these are not procedures that I would have performed when I first started performing earwax removal. They're very complex. You can see the skin's almost an invisible layer, and the ear's very sensitive, and it's just through years of perfecting my trade and my skills and experience. There's no substitute for that, if I'm honest. I now feel comfortable performing these procedures, but when we train our clear wax delegates, I wouldn't advise any of the clear wax delegates in the first instance to perform these procedures. We'll just say, look, clear that blockage, let these, their hearing's better, and the feeling of fullness is better. But with the skin peels, would advise against doing that first, and either referring further to another specialist, or sometimes these can also be treated with medication. Now, in this particular instance, the patient has been prescribed an antibiotic spray to help with their otitis externa. It's a chronic condition, so it's nothing new for the patient. And they're doing everything else right. They're avoiding water in the ear. They're not sticking cotton buds in there either. So they're doing everything they can, but unfortunately, some people just have this condition, and it's just managing it and keeping on top of it. So we're just trying to peel some skin off the eardrum here. Now, the patient has got a bit of greasy hairs at the entrance. They have been using the antibiotic spray, so occasionally it's a bit greasy. We just come out and wipe the lens. You can probably see the entrance of the ear. It's a bit more inflamed, a bit more red. Looks really dry. And once more, we're just using the fine end suction probe. Now, when you're peeling dead skin, you want to try and avoid, if possible, using the standard Zollner suction probe, because that will cause clarinetting. So clarinetting is when the skin, as a suctioning it, at the tip of the suction probe, it violently flaps. And that violent flapping emits a very loud, high-frequency sound. And not only is it somewhat deafening for the patient, it can be deafening for the practitioner performing the procedure, because it is really, really loud. With a fine-end suction probe, you tend to get less clarinetting, and sometimes you don't get any. Now, you can see the skin on this ear, it's a lot more thicker. Just by looking at it, it just feels itchy. So these are one of the procedures that even myself, I felt a lot of satisfaction and a lot of relief. A lot of the comments I read on social media about why people watch the videos, I actually experienced that myself after, also during performing this procedure, because I can just imagine how having that, it's one of the worst things, I suspect, having an itch, and by scratching that itch and making it worse. Now, let me explain why scratching your ear, if you've got an itch, can make, in the long term, your symptoms worse. So this skin, as I said, as it dies and sheds, it moves sideways in a conveyor belt motion, and that's important for us because it helps the ear to self-cleanse itself, and any wax sitting on the surface, it also takes that and transports that out of the ear. So we want that natural migration to occur. Now, if you start scratching your ear with your fingertip or whatever it may be, a Q-tip or cotton bud, you're damaging that lining of skin. So that migration of the skin no longer occurs in that region where you've poked and scratched inside. So you're naturally going to get a bit of skin buildup in that region. Also, that part of the ear where you've damaged and scraped the skin cell layer, the epithelial skin, this an epithelial layer of skin, we call it. As that epithelial skin cells start to regrow and regenerate, that growth of the skin is actually itchy for you. So in other words, by scratching your ear, for example, if I was to scratch my ear today, in probably a couple of weeks, I've always guaranteed myself an itch, because as those skin cells regrow, it's going to itch. So that's why we try and advise you to avoid scratching your ear and poking inside. Just removed a lot of dead skin off the eardrums, a bit here, because we have a really, really steady hand, and it was a bit crusty here, so I managed to get a little bit off, but I just left the remaining part because it was actually clarinetting on that region a bit, if memory serves me right. And you can see it's a lot better. It's still, you can see you can just tell the ear's a bit drier than it should be compared to a normal, healthy looking ear. So when we perform the procedure, we're not going to be curing the patient of their otitis externa. We're just trying to clear as much dead skin away as possible to relieve their symptoms, and then It's just, as I said, they're going to have to come regularly to have this done, and alongside the antibiotic spray. So what can you do yourself to, if you've got itches, what can be done? Now, there's probably more don'ts than do's. One of them I just explained, don't poke in your ears. You are kind of, I know it's hard, I can imagine you've got an itch, you want to scratch it. It's the most natural thing one wants to do. But you want to avoid that. So what you can do, there's in the UK, we've got sprays over the counter that we can get, acetic acid sprays. Some people use an olive oil spray. So this olive oil is medical grade. It's specially formalised, treated, sterilised in such a temperature to ensure all the possible impurities that can cause infection are removed. You can put a bit of that because the oil will act as a moisturiser. Avoiding water, that's a big thing. You want to avoid water entering your ears, as water can exacerbate any itchiness and help form dead skin in your ears. So they're probably the three things: avoid water, avoid cotton buds, and you can use an olive oil spray as a moisturiser. If you do still get very damp ears, another trick is, I used to recommend almost a hairdryer from a distance and at a cool temperature. You don't want that hairdryer being too hot or too cold because it can induce the caloric effects. It can change the temperature in your ear, causing dizziness and vertigo. And you don't want it at a high pressure either. So now, my hairdryer, I've got an eco mode, so it's room temperature, which is the best for when using with the ear. And obviously, don't put it at the lowest setting. Don't hold it close to your ear. That's, you don't want to be damaging your ear, barotrauma. Just from a distance, so just so you can feel a gentle breeze going to your ear, because you want to keep your ears dry as possible. So if there is dampness in your ear, definitely use that. That's one thing you can do. Also, one of those little handheld fans that with battery powered, you can just put that next to your ear, and that will help just the air circulate in your ear, just to keep trying to remove any of the dampness. So there's a few tricks for you. I hope you enjoyed that videos and you found it satisfying, because I know there's a lot of viewers enjoyed the skin peels. Hope you're all having a good weekend. Take care, and I shall speak to you all soon. Bye.